Good day, everyone. So I am Nathaniel Soneja from BSN-3B, and my report for today is the dental surgery. Here are the learning objectives. What is dental surgery? Indications for dental surgery. The nurse responsibility. Surgical setting. Specialized instrument and accessory items. Surgical asepsis. Surgery. Preparation for surgical procedures. Sutures or type of sutures, preoperative nursing care management, postoperative care management, and post-surgical complication. So dental surgery, or also called maxillofacial surgery, it is a specialty of dentistry involved in the diagnosis and surgical treatment of diseases, injuries, and effects. Indications for dental surgery. We have extractions of decayed teeth that cannot be restored, surgical removal of impacted teeth, extraction of non-vital teeth, pre-prosthetic surgery to smooth and contour the alveolar ridge, removal of orthodontal treatment, removal of root fragment, removal of cysts and tumors, biopsy, treatment of fractures of the mandibular or maxilla, surgery to alter the size or shape of the facial bones, surgery of the temporomandibular joint, reconstructive surgery. We also have cleft lip and cleft palate repair, salivary gland surgery, surgical implant procedure. The nurse must have advanced knowledge and skills in patient assessment and monitoring, specialized instrument, surgical asepsis, surgical procedure, pain control technique. For surgical setting, we do surgery in dental operatory, surgical suite, operating room. And here are the specialized instruments and accessory items. We have elevator, used to apply leverage against the tooth to loosen from the periodontal ligament and ease in the extraction. We have three types of elevator. First is the peristyle elevator, straight elevator, and root tip peaks elevator. We also have surgical curettes, clean and scrape the interior of the tooth socket to remove diseased tissue. Rongers, it is to trim alveolar bones. Bone file, to smooth rough margins of the alveolus. Scalpel, a surgical knife to making precise incision into soft tissue. Hemostat, it is to grasp and hold things. Needle holder, to firmly grasp a sutured needle. Surgical scissor, for trimming soft tissue. Suture scissors, for cutting suture materials. Retractors, to hold or retract tissue during surgery. Mouth prop, also known as bite block, allows the patient to rest and relax the jaw muscles during surgery. As you can see sa picture po, the blue one is the mouth prop. Chisel, either in the single bevel or bi-bevel design. The single bevel is used for removing bones, bi-bevel for splitting teeth. Mallet, source of pressure used on the chisel handle. Surgical burrs have extra long shanks and used to remove bones or to cut or split the crowns or roots of the tooth. As part of surgery, we nurses should perform surgical asepsis, or we should observe surgical asepsis. Surgical procedure invade open tissue. The surgical team must follow a sterile technique, such as a field, site where the surgical instrument and accessory items are placed during surgery. Surgical scrub. It is a type of hand wash used to lessen the chance of infection. We also have proper gloving. When assisting in an invasive procedure, you must wear sterile gloves. Here are the surgical procedures and dental surgery. First, we have forceps extraction, surgical removal performed on a tooth that is fully erupted and has a solid intact crown that can be grasped firmly with the forceps. Multiple extraction and alveoloplasty. It is a multiple extraction procedure involving the contouring and smoothing of the alveolar crest of the surgical site. Removal of impacted teeth, a complex extraction of a tooth that has not erupted, soft tissue impacted or hard tissue impacted. We also do biopsy. It is a surgical removal and examination of lesion in the oral cavity. We do incision biopsy, excision biopsy, exfoliative cytology. For suturing or sutures, it is the act of stitching. It is placed to control bleeding and promote healing of the wound or on the surgical site. Two types of sutures. We have absorbable sutures and non-absorbable sutures. Some sutures. Absorbable sutures, we have pin catgut, provide the fastest healing for mucous membranes and subcutaneous tissues. Chronic catgut provides a much lower healing, allowing the internal tissues to heal first. McNeil, a synthetic absorbable. For non-absorbable sutures, we have silk for its strength and its ease in use. Polyester fiber, one of the strongest sutures. Nylon for its strength and elasticity. So here are the preoperative nursing care management. Preoperative care, advanced preparation. We have all patients' records and radiographs in order. Have consent forms signed and available. Information requested from patient's physician has been received. Check for laboratory surgical setups prepared and sterilized. Provide preoperative instructions for taking any premedication. Treatment room preparation. Place protective barriers. Keep surgical instrument in their sterile wraps until ready for use. Have appropriate pain control medication set up and ready for administration. Have post-operative instructions ready to provide to the patient. Patient preparation. Update medical history and laboratory reports. Check with the patient that any prescribed medication was taken as directed. Place radiographs on pubax. Take vital signs to determine a baseline. Sit and pray. Position the for post-operative nursing care management. We have to stay with the patient, give verbal and written post-operative instructions, schedule a post-operative visit, update the patient medical record, return the patient record to the business assistant, break down and disinfect the treatment area. As part of post-operative care is the control of bleeding. A 2 by the gauze is folded and placed to control bleeding to encourage clot formation and healing. Keep gauze in place at least 30 minutes. If bleeding does not stop, call the dentist. Do not disturb the clot with your tongue or by rinsing your mouth vigorously. Strenuous work or physical activity is restricted that we also control the swelling. The use of ibuprofen before and after surgery. During the first 24 hours, a cold pack is placed in a cycle of 20 minutes on and 20 minutes off. After the first 24 hours, external heat applied to the area to increase circulation in the tissue and to promote healing. After the first 24 hours, the patient can begin gently rinsing the oral cavity with warm saline solution. Here are the post-surgical complications. We have alveolulitis or dry socket. Here are the costing factors: inadequate blood supply to the socket, trauma to the socket, infection within the socket, diseasing of the blood from the socket. So that's all. Thank you so much.